Well, good afternoon or good morning, depending on where you are. My name is Kevin Ring, president of FAM, and we're back with another edition of our Facebook Live series, Heart to Heart. And today we're going to be talking about Arizona and how the prison system there is or is not responding to the COVID crisis. We are very grateful to have bipartisan leaders from the state who are going to join us and talk about what they see going on and how families can become better advocates to make sure that their loved ones are taken care of. And to introduce them, I want to introduce you to Molly Gill, FAM's Vice President of Policy. She's been with FAM longer than I have, and she has been involved in so many of our successful efforts at the state and federal level. And so I'm going to ask Molly to introduce our guests.
Great, thank you so much. And I'm so glad to have a bipartisan team here that I respect so much and have really enjoyed working with in Arizona. We've got Representative Walt Blackman here, who has kindly chimed in while he's on the road and on the move. So we really appreciate you. Even though you're on the move, you're taking time to be here today, and we're so grateful for that. So Representative Blackman is a Republican representing District 6 in Arizona. He's from the lovely town of Snowflake, which I have not yet been to, and represents also parts of Coconino and Yavapai County. And he's on the Judiciary Committee. He has introduced several really important sentencing and prison reform bills, and his earned release credit bill passed unanimously in the House earlier this year, which we were thrilled to see. And I think perhaps even, equally thrilling was watching Representative Kirsten Engel stand up on the House floor when that vote was taken and thank Representative Blackman and congratulate him on running such a successful bill. And it was one of those lovely bipartisan moments that you see in criminal justice reform where both parties can agree that our system is punishing people too long and agree about the right thing to do to try to fix it. So Representative Kirsten Engel is a Democrat from District 10, which is part of Pima County. She's an attorney. She's also a law professor at the University of Arizona, which I did not know until this morning. So thank you so much for being here with us today. We really appreciate it.
Screwed up the time a little bit with you, Representative Blackman. And so we'll start with you, but just to introduce you to the folks who may not know you, FAM has run a couple series called Why I Care, where families who have loved ones in prison talk about why they care about this issue and why it means so much to them. And I thought I'd start that way with both of you, which is, there's a million issues to work on, and not everybody is attracted to criminal justice reform. So what is it that draws you to this issue, and why do you care? And I'll start with you, Representative Blackman. And thank you for joining us.
Thanks. If you look at the current price that we pay for per inmate, $25,000 a year per inmate, the budget is about $1.1 billion for Arizona. That takes a huge chunk out of our general fund. And it's not just about the money that alarms me. It's about the reintegration for these inmates that leave our prison systems, AZDOC, and are not able to integrate back into society because of lack of skills or lack of transition programs that the state has. So my take in this was I wanted to make sure that, number one, the streets are protected, communities are protected, and that people are not re-offending when they get out. And we need to make sure that they have the proper programming and tools to be able to do that. So that's why I got involved in this.
Thanks. Representative Engel?
Yes, I couldn't agree more. I think Representative Blackman has really summarized it well. Arizona has the 5th highest incarceration rate in the country. We also have an extremely high recidivism rate. So we are locking up a lot of people. It's really the conditions of our prisons, to me, is a human rights issue. These folks are residents or citizens here, and they have a right to adequate health care. They also, as Representative Blackman discussed, they will be rejoining our society. And we want to make sure that they are healthy and that they are ready to contribute to society. So we have an obligation for their care while they are in our custody. And, they're human beings, they're community members, and we want to make sure that we protect them and we protect society, and that we have a safe and productive economy going forward with them as a part of it when they get out.
Yeah, I want to ask, most of the questions we'll ask will come from directly impacted families who are, who work with FAM and work with our partner group, Arizona Start. And I'm going to get to those questions. But I want to start, they're already asking about the legislative session and what it means for reforms that you all were pushing. What do you foresee now with the closure and all the rest? And what is that going to mean for the positive reforms you were pushing even before COVID? You may have to take this one.
Okay, well, right now it looks like we are going back tomorrow morning. We were told over a week ago that we were going back to end the legislative session. We haven't gotten clarity on that more recently, so we're not entirely sure if we're going to be ending the legislative session or not. If we did end the legislative session, I think the plan would be that we would come back later and have a special session just on COVID-19. I think that special session could definitely address issues related to the prisons and preparedness for further outbreak in the prisons, preparedness of the staff, etc. But barring that, if we do end the legislative session tomorrow, I have to say the bills that we have been working on this session will be dead, and they will have to be reintroduced next year. And that is a real loss for many of the important bills that we were able to pass, such as Representative Blackmon's Earned Release Credit bill. So that would be very unfortunate. On the other hand, these are very, very unusual times.
Yeah. Well, I know we don't have you for very long, Representative Blackmon, so I wanted to ask you, aside from the sort of normal course of business, families are most worried right now because of this COVID crisis. And I know that extends beyond prisons to nursing homes and everyday citizens. The biggest complaints are just about the lack of transparency and testing in the prison system. And I was just wondering, I've heard it said that, this crisis is testing good systems and bad systems are failing. And I think a lot of people feel like Arizona's prison system was not really doing a terrific job before this. And so I'm wondering, what is your impression of how they're responding to this, and for the families who are concerned that they're not getting information about their incarcerated loved ones, or they're not being tested? What would you say to them?
Well, I would say that we need to be more transparent when we're dealing with these types of situations, especially during this crisis, during COVID-19 crisis. Families are concerned about their loved ones that are in prison, and that they should have information, a smooth flow of information of what's going on. So I think we can do a better job at that, but we're not doing it. And if I had a bill that I was able to get written with the help of Ms. Gill, and it was a transparency, an ombudsman bill. And if we were able to pass that, we wouldn't have these issues because they'd be able to see what's going on. So that's my take on that.
Yeah, no, it does seem like transparency is something that's missing. Representative Engel, I can't tell you how frustrating that is for families and how much that lack of transparency is increasing anxiety when it could just be the opposite. And so when you see things like the first prison death not reported for a couple weeks, after lawmakers were told that there weren't any prison deaths, and then you see that only 0.5% of the population has been tested, and that a quarter of those are positive. And so people worry about, if there were more testing done, how many more are positive? No press conferences from the director. Information about staff testing is not available. Just on and on. And that kind of black box increases anxiety for families. And I just, I don't know. I know the families feel powerless, but as lawmakers, what do you feel like can be done?
Well, I can't imagine what some of these families are going through, quite frankly. The information that we do receive is not good information. And I can only imagine what they are going through as they fear for their loved ones, whether their loved ones are correctional officers or staff members, or any of the over 41,000 inmates that we have in the state prison system. The information that we have received is just a trickle of information. And as you said, the rate of infection for the amount of testing that has been done is really extremely high. 25% have been infected. And apparently, I understand from the World Health Organization, anything over a 10% infection rate with respect to this disease demonstrates that you are way under testing your population. So our fear is that the virus could be much more widespread and that the department is keeping the testing low. I hate to say this, but maybe so that there aren't that many number of cases that are actually reported. And that kind of approach to the information that we need to make sure that they are doing an adequate job in responding to the health crisis here is just unacceptable. So we have been working as much as we can, asking for meetings, writing letters, follow-up questions, emails. We have had a couple meetings with the director. We have received some information, but clearly there's just huge gaps that are left. So that I think has been the most frustrating aspect of this.
Yeah, Representative Bagan, and I was going to ask you, and then I'll open it to Molly and get to some of these questions. You know, FAM's view on this has been that, you know, the job of the people holding folks in custody is to either keep them safe or send them home. And in some cases, you're seeing governors across the country, even the White House and the Trump administration, Attorney General Barr is using his authority to give home confinement to more people, to get vulnerable people out of prison. Governor Ducey has said that he is not interested in releasing anybody. And that's happened in a couple of states, but that combination of not releasing anybody, even people who might be especially vulnerable to this disease, and then lacking this transparency. I mean, do you think there's more that the administration could do on this front?
You're asking me?
Yeah.
Okay. Yeah. You know, that's a tricky question. If the person who is incarcerated is a nonviolent, non-dangerous, and non-repetitive, and they were due to get out within the 6 months, and they were ill, then I would see that would be okay to do. If the person was a violent, dangerous, repetitive, then no, because my number one priority from day one was to always keep communities safe. And in order to do that, some folks need to be locked up, and then some folks don't. But I think we at least have to take a look at the demographic and the population that's in question. And then we can make an intelligent decision from there instead of just doing a blanket no.
Right. Yeah, no, I think that makes sense. And I mean, and I just want to say one thing, because you guys have both talked about public safety and public health. And I think one thing that's gotten people haven't fully understood this issue is that we view these as connected. These are, prisons are not cruise ships that are sealed off from the public. I mean, you have officers coming in and out and healthcare professionals. And so we've seen in other states where the community is affected when the prison is infected. And so, it's not as if we can just, even if you don't care about prisoners or their families at all, if you care about public safety and flattening the curve, we've got to address COVID in the prisons. And so, I think what's been amazing to see is even, Carlos Garcia, who, heads up the union for the officers, is talking about a walkout because they're so frustrated about the conditions, not just for the people inside who are incarcerated, but for the officers and what that means for them to go back out to the community and for their families. And so I think there's no trade-off, or there's no distinction between, do we care about prisoners and do we care about the communities? Those are affecting one another. And so, I mean, do you think people understand that, or does it seem like just an issue that, prisoners' families care about, because it really isn't.
Well, I think that it's just the prisoner's family that understand this, because if you don't have a connection right now of somebody either incarcerated or has been incarcerated, you're not going to look at it from their perspective. And I've always looked at it from that point of view, because it's in Arizona, it is very easy to get arrested. It's very easy to get placed in our correctional facility. It's easier than most people think. So I try to put myself in their shoes and what they would be going through. So I think that if more lawmakers are able to do that, then the decisions about how we run our prisons and about when we have this crisis epidemic that's going on, I think we'll be able to make better decisions on that. But we at the end of the day, we need to take a look at our system, fix it, and understand that these folks are people. They committed crimes, understand that. They're human beings. And we need to start looking at them that way.
Yeah.
And I think, what we're seeing with respect to the COVID crisis and the prisons is exactly the same as the larger criminal justice issues. Just as Representative Blackman has said, these are our community members. It's very easy in Arizona to end up locked up in the prison because we have a very high rate of felonies here and a very high rate of people serving time, even for a first-time felony here. But these are people that are going to rejoin the community. So that's an additional reason for why we need to make sure that we're just not, throwing people in jail and letting them rot in there. But if they are going to go to jail, we're providing services, drug treatment, mental health services, skills for them to get a job when they get out, because they are going to rejoin society. And it's the same thing with the COVID virus. One of the things I've really adamantly disagreed with the director about is he has said several times that these are kind of sealed off places, that he has said it's one of the safest places to be in Arizona. But that is absolutely not true. Correctional officers often live in the nearby community. They are going back and forth to their home and into the prison. Staff members, not the inmates, but it is not a sealed off environment in any way. So not having the information about whether correctional officers are being tested, what we know about their infection rate, is really preventing us from understanding what the risks are to the prisons, because they are certainly not sealed off in any way.
Hey, Molly, do you want to jump in with a question? And I'm going to start going to the family questions.
Sure. I was just going to ask, what do we need to know from ADC that we don't know? And you just sort of answered that. Staff testing obviously is very, very important. I think also, there was some concern recently about someone who died 2 weeks ago, and just, this week we found out that that person died because they had COVID-19, and that was not made public by the Department of Corrections. And that's every family's worst nightmare right there. And so, again, I'm just so grateful that Representative Blackman has taken on this ombudsman's bill and this transparency issue. And I'm so glad, Representative Engel, I'm grateful that you've been writing, calling, emailing the Department of Corrections. But we absolutely know that we have a transparency crisis at the ADC, when the only way we can get information is if you have a whistleblower on the staff who goes to a reporter who's willing to cover the issue. I mean, we have reporters, Dave Biscobing, Jimmy Jenkins in Arizona. They do a great job covering the Department of Corrections, but frankly, we shouldn't have to rely on them to get this kind of information. And I'm sure it's incredibly frustrating to the families in our group to hear that even a lawmaker can't get information from the Department of Corrections. So this is just an absolutely unacceptable for a government agency that's in charge of 41,000 lives and spends $1 billion taxpayer dollars every year. So we need to work on this.
If I could chime in real quick, I've got to get on the aircraft, and I am so sorry that I had to get out of here a little earlier. I agree with everyone what you're saying. And my colleague, Representative Ingo, is awesome. She's on judiciary. I do appreciate her insight. Molly, thanks for everything you do. And I want to thank you for letting me on here, Mr. Ring.
Oh,
And I am sorry that I got to get on this plane.
no problem.
Phoenix, but
No
thank you so
problem.
much. I
All
appreciate
right, be
it.
safe.
We appreciate you. Thanks.
Well, I'd just like to add, the information about that a death had occurred in one of the prisons 2 weeks before it was reported to the public. That was that I think synthesized all that we're concerned about, and it was really an egregious example. We had actually been on a call with the director just a few days before last week and asked him point blank about that. And I don't know how that they are interpreting a death. He said, we have not had any deaths occur among inmates. Perhaps they are meaning a death occur on the site of a facility as opposed to a hospital. But of course, any deaths from the virus will most likely occur in a hospital. We've talked to the director about the need to make sure that there is sufficient beds and facilities available for sick inmates. And he talked about how they would be removed to a community hospital because they don't have things like ventilators in the prisons. So of course, any deaths that do occur will occur off-site. So very discouraging that we didn't get that information. And that's an egregious example, but of course, we're not getting information about even whether or not correctional officers are being supplied with PPE right now. We were told that they were going to be supplied and they'd be supplied by the department. But of course, we have the head of the Correctional Officers Association saying that they haven't received that. And indeed, they are, they will go to the length of a walkout if they don't receive it. So this is, there's a disconnect here between what we are finding out from other sources and what we're hearing directly from the department.
Yeah, I want to jump in with some of the questions that folks are asking, and I mean, there's a couple that keep coming up, which is why isn't DHS inspecting these facilities? And I saw this question raised yesterday when Director Shin testified. They admit that this is not something that some of these prisons are prepared for, and yet they're not allowing public health professionals into the facilities to see how things are going and to observe these places. And so we've seen this around the country as well. You have problems in, nursing homes and prisons where, things spread fast, and where in both cases, loved ones can't visit. So they want information. And it just seems like something the state should be able to do, is to make sure that these places are inspected and to have a different, if we don't have an independent agency right now, at least the administration's health department. So what do you think stops that from happening?
I don't know. I think a sort of silo mentality that each of these departments are their own entities and they don't check into each other's business. That's all I can think. We are reaching out to the Department of Health. The governor has made it very clear that the Department of Health is really the front line agency during this crisis, and Dr. Christ, who heads that department, has been very prominently put forward as the state's lead person in the response to this pandemic. There is also an emergency response plan for the state that puts ADHS in that role. So we think that ADHS should be taking a much more active and aggressive role. They should be overseeing the measures that are being taken by DOC. They should be advising them in what they are doing. So we intend to look into that and ask that that be done.
Yeah, some questions about home confinement and other things about, compassionate release, elderly release, those types of things. And I guess what I'd ask you is to sort of try to synthesize those is, what's the I mean, it may be both, but is the problem a lack of political will? Is it a problem of authority? Does the state not have existing authorities to address something like this? I mean, I know the governor has we wrote to the governor about using his reprieve authority to get people out, at least who are vulnerable and sick. And he's expressly stated he does not want to release people. But I mean, I guess if you were Czarina and you could sort of decide, I mean, what would you do in a situation like this? Because I mean, I'm just looking at the federal level where we just lost a 30-year-old pregnant woman. She wasn't pregnant. I mean, she was hooked up to the ventilator. They took the baby out by C-section and she died a short time later. And this is somebody that, the Federal Bureau of Prisons says, she had pre-existing conditions, which to me is an indictment, because that means you knew she had pre-existing conditions and you kept her in. And I just feel like the answer can't be 0 releases from Arizona. It just can't be that there is no extra bodies there. We know your prisons are, fifth in the country. Your staffing is short, even in good times. And so how can it be that when a pandemic like this hits and businesses are being forced to close, the governor just extended the stay-at-home order, that there doesn't need to be any changes to the makeup of the prison population? It just doesn't even stand to reason.
Well, it is a difficult issue. And I think the problem is that we're dealing with an administration that doesn't even want to look for solutions. So I think we are faced with a problem of a lack of a sort of statutory scheme that provides for furloughs and releases, home confinement. We have looked at some of those authorities, and we haven't looked at them exhaustively, but it's not as clear to us that there is an easy route for the department to take. Nevertheless, we haven't, that doesn't mean that the governor might not have that authority under his emergency powers, which are incredibly broad. It certainly doesn't mean the governor can't go to county attorneys, go to the courts, and try to figure out a plan and get maybe the sentences reduced or changed into some kind of home confinement process. So even if the Department of Corrections cannot do it itself, I think there are some other options that can certainly be explored. And yet what we are getting back is, no, we cannot even address that. It is beyond our capability right now. And B, it would be too much of a risk to public health. Yeah. And we're talking about, we have a lot of elderly prisoners. We have prisoners with health conditions that make them especially vulnerable to this disease, cardiac, respiratory problems. So we have, I think the Department of Corrections has said they have something like 6,600 prisoners who are elderly and otherwise vulnerable to the disease. So I think those people should be the first priority for looking at what we can do to remove them from a situation where they could get the virus and have a bad outcome. We also have very high levels of nonviolent offenders in our prisons, and you have got to, I don't understand why we're not looking at those people and saying, look, these are not the people we need to have confined right now. The real issue that we have in the prisons is a lack of space. And we've heard this from the director of prisons. We know it from visiting the prisons. People are very tightly housed in our units. A lot of them are in dormitory style rooms where you have, literally a couple hundred inmates just in bunks next to each other, so that, the transmission of the virus could happen very easily. So one of the things that we would want to do is to somehow, trim the population so that they can be spread out. So you have social distancing in the prison so that you don't have the prison spread so easily. And you can't do that with the current number of prisoners that we have, unless you're going to build new facilities on a very short time frame. And we don't even know if that's happening.
Yeah. Molly, you looked into this. I mean,
Yeah.
I think that's right in terms of existing authorities. I mean, right?
Yeah, what's so evident when you start looking at Arizona law is that it's very easy to put people in prison and it's almost impossible to get them out. And that's not some kind of accident, and it's not just a matter of political will. There are just very few legal mechanisms that allow even wardens, they have extremely limited furlough ability. They can only put a very small number of people on furlough for a matter of days or weeks. And Arizona is just not even legally equipped to deal with a crisis like this. And so I think certainly FAM's top priority, in terms of the next legislative steps are going to be, we need to fix that. Arizona is one of the only states in the country that doesn't have any release mechanism for the ill and the elderly other than medical clemency, which we've seen the governor be extremely reluctant to grant. He's had, at one point recently, he had 5 medical clemency requests that have been approved by the Board of Pardons sitting on his desk. He's only granted 2 of them. One person made it home and died within hours. And so it's just, we're seeing this incredibly stingy, there's really no other word for it, this really stingy use of the medical clemency power. And so we've got to create another option than that. It can't all go to the governor's desk. We've got to have some kind of statute like the other 49 I guess 44 states have that allows you to go before someone else and be considered for release if you're very ill and very elderly. I think we do need some kind of home confinement authority. And I think in terms of thinning out the population, that's why sentencing reform is so important. And Representative Engel, you've really been a leader on this, putting forward some really bold ideas, about getting rid of mandatory minimums, giving judges a lot more sentencing discretion in Arizona. Even last year we tried to pass some reforms to the repetitive offender enhancement, so people weren't getting these outrageously inflated sentences for these tiny priors, and the governor vetoed that bill. So we need to think long term. I think after this is over and when the legislature is coming back in session. And I also have been hearing some talk that, when this is over, the Arizona legislature is going to have a very big hole in its budget, as I think a lot of states will, something to the tune of at least $1 billion is the number I've been hearing. Representative Engel, do you think there's an opportunity there to, maybe promote some of these reforms that are going to save some money? The sentencing reform does save money and the state needs to plug that hole up. So is there an opportunity there for us?
I think there is. And, even among folks who, do not see the benefit of some of these reforms for other reasons, they do listen to the money issue. And I think Representative Blackman, that's the first thing he talked about when we started this. That we're spending something like $23,000, $24,000 a year on each inmate. That's more than the state spends on, college students. It is a very, very high bill. Over 1/10 of Arizona's budget right now, over $1 billion, is spent just on the Department of Corrections. And that's clearly not, the total bill for the whole state when you bring in things like county jails and county attorneys' offices and all the other pieces. So we are really spending a lot on our criminal justice system. And then you've got to question, well, what are we getting out of it when we have such a high recidivism rate? So we will be facing quite a big gap in our budget. I think we've already been looking at the projections over the next year of over $1 billion shortage. So I think lawmakers will be looking to save money, and maybe that will finally be the trigger that lets them take this seriously. Because of course, I think we can do a better job in reforming individuals, reducing our crime rate, reducing the recidivism rate, if we address, if we don't just lock people up for long prison sentences.
Representative Engel, a question we've got and we always get, especially in a state that's tough to make change in, like Arizona, families get discouraged and they do feel somewhat powerless because they know the problem exists. And, you know, if you have a governor who doesn't want to do anything and the legislature doesn't seem inclined to help, it does feel very difficult. And we say that as paid advocates. But they're asking, you know, what can they do to make sure that there is more accountability? Like what hits for you as a representative? I mean, is it just hearing from constituents? Is it, you know, lobby days, or like, how can they make their voices heard? Because there's thousands and thousands of people who want the type of reforms we're talking about. They want more accountability and transparency from the corrections department. What can they do? What is your sense of that?
Well, I think right now, you know, there really has been good information coming out about the disconnect between what is going on in the prison system and what we're hearing from the Department of Corrections. And, you know, I hate to say it, but we need to know more about that. So information that families know about the provision of, you know, sanitary products, soap, gloves, masks, anything they know about prisoners who should be tested and are not being tested, correctional officers that appear to be sick, any of that information, they should be sending that out, sending it to your representatives, send it to me, send it to members of the press that are watching this very closely. I think we need to make sure that the department sees that they can't hide this information. The information is going to get out anyway, and it doesn't make them look good. The other thing is, I really think, you know, showing the humanity and lives of the people in our prisons is very important. I think our society sort of objectifies inmates. They're other, they're criminals, they're dangerous. And, you know, obviously many people do need to be separated from society and be in prison. But on the other hand, there's so many prisoners that are doing the best they can. They're trying to take advantage of whatever opportunities they have in the prisons, and they really want to do well in society. And I think that, you know, getting those stories out makes us understand that these are human beings. These are people who will be our neighbors when they get out, and we need to make sure that they're okay. And we need to make sure that they have the tools that they need to succeed when they get out.
Yeah, I wanted to follow up. If this seems like I'm repeating myself, it's only because this is a, you know, a common question we're getting, and I understand it. And I also want you to know it's not directed at you, because I know that you would do things differently. But it does feel like a disconnect that, short of the ACLU suing the prison system over their crummy healthcare, short of, you know, some brave whistleblowers and some dogged reporters, that elected officials in Arizona can't get information about another government agency that oversees tens of thousands of people's care and custody. And so there's no press conferences from the director. There's just nothing at all. There's no accountability. And that's geared at you all. I mean, so the family members who call the warden to check on their loved one and don't get answers, or they hear what's being said to their loved ones, you know, behind the bars. I mean, that disconnect is so hard, I think, for people to appreciate. The idea that their elected representatives cannot even hold accountable this agency that has their loved ones' lives in their hands, especially during a time like this. And so things like that healthcare crisis, the lack of testing and transparency, the not reporting the death, those, all of them individually seem like big enough scandals to demand that these officials come before the legislature and answer questions, whether by subpoena or otherwise. And so what am I missing? Because I worked on Capitol Hill, and I mean, I must say I share that frustration that this agency can be so rogue and careless with these lives, and everyone is powerless. I mean, I know that's hard.
I wish I had a better answer. You know, the other thing is really, you know, making sure that the governor is accountable for this. You know, he put the director in place. You know, we are in a state of emergency right now in which the governor has very, very broad powers. and those broad powers, cannot be used as an excuse to not respond to the public. I mean, unfortunately, during this time, the legislature, we have been in recess, and it's likely we will actually, even end the session tomorrow. So the legislature, besides, what we can do in terms of writing letters and demanding meetings and answers, we're not able to have as much of an oversight function as we otherwise would through things like, our Judiciary Committee hearings. Yesterday, there was a hearing by the Joint Legislative Budget Committee on some facilities issues, and the director did testify at that, and there were questions that were posed, I know, related to their preparedness and response to COVID-19, but it was very difficult to get at those issues because they were not directly related to some of the facilities issues that were in front of them. So we're really in a situation right now where we don't even have our usual sort of oversight powers that we normally have. It's really kind of the governor's show. Nevertheless, let's hold the governor accountable. At his press conference yesterday, when he was talking about extending the state shutdown for another 2 weeks, the media was starting to ask questions about the Department of Corrections. I think the word is coming out. We didn't get good responses from the governor, but I think that was an indication that people are hearing about this and they are not happy with what they are hearing. So keeping the governor accountable, I think we should be going directly to the Department of Health. What are they doing to oversee the prisons?
Yeah, you can imagine what it feels like for these family members to hear the director say that people are safer in prison. I mean, it's an obscene statement, 6 months ago, and today it's almost, it's just so galling.
If that were the case, I would challenge the director to move into the prisons.
Yes, that's how I felt. Yes, exactly. Right. If it's so safe, we should all go.
That's right.
Molly, I know you're used to this, but I mean, for family members who are frustrated and feeling powerless, I mean, how do you stay engaged and get involved, and how do you move this rock up the hill?
Yeah, I think, I mean, I say it so many times and people probably get sick of hearing it, but as Representative Engel herself said, it really actually is important to share your story, to share it with lawmakers. I mean, especially, I think we've just spent, 40 minutes talking about how lawmakers can't even get good information about what's going on in the prisons. You are a source of information. So I echo Representative Engel, you got to share your story, write your lawmaker, write them until they get sick of you, write them until you're that person who's always sending the letter. And, they do need to understand this. They need to know what people are experiencing in the prisons. I think also, the START project is one of our partners here. They have a Facebook page. Join START, sign up for the START project, sign up for FAM's emails. We will send you email updates about the legislature and its work. We will send you ways to take action so you can support these bills when they come through. We worked hard on the earned release credit bill, and you guys sent letters to your lawmakers supporting that bill, and that helped them to pass it unanimously in the House, which that was an extraordinary accomplishment legislatively, and something, frankly, that I never thought I'd see in Arizona. I never thought I'd see a criminal justice reform bill pass any House unanimously. So I do think there are ways that you can get involved, ways that you can take action. I also put in the plug for self-care. I think it's, I don't have a loved one in prison, so I'm not going through what you're going through. But I do think you can't be a good advocate for other people if you yourself are run down, weary, exhausted, wiped out. So you do need to take care of yourself for the long term as an advocate if you're going to be an effective advocate for your loved one. Turn off the news, take a break, take a walk, go bathe in some of that beautiful Arizona sunshine. Really do try to take care of yourself, because by taking care of yourself, you're going to be better at taking care of your loved ones in there. So I do know that reporters right now are getting bombarded with stories, but you know, Jimmy Jenkins, who I mentioned, he's at KJZZ, he's on Twitter and he will take your DMs. And, you know, so if you want to tweet at Jimmy Jenkins and Dave Biscobing, you know, the other at ABC 15, they want to hear these stories. There's some of the reporters working on this. I know Maria Pauletta is another Arizona reporter working on this. So I do think it's important. And then also, you know, you have power at the ballot box. Register to vote. Make sure you get registered. Make sure you're, you know, there in November and choosing candidates who, you know, care about these issues and who, you know, come down the right way, you know, on these issues. Definitely, it's so important to vote. And this election, I think, is going to be a really big one nationally, but also at the state level. There's a lot of people retiring, a lot of new blood coming in. And it's so important to be informed about who represents you in your legislature and to make sure that they care about these issues.
Yeah, I just want to echo one thing you said, which was there are a lot of groups in Arizona that are working on this. As you mentioned, our partners, the START Project, but our friends at American Friends Service Committee, Forward.us, Justice Action Network. There's a lot of groups are working across the political spectrum on this. And so, you know,
I'm going to plug ACLU of Arizona. They do some great protests and really have a way of drawing attention to these issues. I know the START Project and Puente and a bunch of other groups recently did some drive around protests where they drove around jails and prison facilities and honked and, you know, plastered their cars with posters calling for releases and decarceration. And, you know, those things, they got news coverage of that, you know, and every protest like that, every news story like that is educating the public and making them aware that those people we can't see behind the walls, they exist, they're real, they're family members, they're meaningful members of our community, and we should care about what happens to them. So there are lots of great Arizona groups to get involved with who are doing really, really important work.
I'd like to echo that. There are just some fantastic organizations, and we're also very lucky to have members of the media who really understand the issues and are really diving in, and they're getting documents, and they're getting the story straight. And they are hearing from families, from inmates, and they're getting that information out. So if you have a story, you have information, reach out to them. You can send me an email at Kengel, KENGEL @azleg.gov, or any of the other members of the Judiciary Committee of the House. I work very closely with members of my own party, Representatives Rodriguez, DeGrazia, and Pollock, but also across the aisle with representatives like Walt Blackman and Representative Roberts. So get your information to us. I think that's very helpful. Voting is so important. It's so important to hold candidates accountable, ask them questions about their stand on criminal justice issues, and make sure that you fill out the census.
Hey, I want to ask you about this. We ran a campaign, you know, called Visit a Prison, #Visit a Prison.
Yes.
And we sort of believe that, you know, if you don't learn, you shouldn't legislate. And a lot of members at the state and federal level just have never been to a prison as guests or as, you know, as occupants. And that really shows up when we go to talk to them about these issues. I mean, they don't know a lot, and they don't, you know, they can't imagine the situation. And so can you talk about, I know you have visited prisons, like how do we get more of your colleagues there? What do you learn by doing that? I think those things are.
It's incredibly important. If you didn't have a prior experience to being a lawmaker, to going to a prison, or you don't have a family member who's been incarcerated, fewer and fewer of those do not. But it is important to see upfront for yourself what these facilities are like, and it really is a wake-up call. I've been on to 2 prisons. And I would really like to go and visit really all of the prisons in Arizona. I think that as lawmakers, we really have an obligation to know what we're doing. I mean, we are in charge of the criminal laws that put people into prison. Those conditions of the prison is they're state-run facilities, and that's our responsibility. I think what I'm overwhelmed with is just what a stark environment it is for the people there. I'm overwhelmed by how old many of the facilities are. They really are old. They're crowded in many places, and there is really almost nothing there. The most important thing that I saw were these programs that the governor has put in for like the last 60 days of a prisoner's term, where they are able to learn a skill. But the sad thing is that they may have been in prison for years before they ever had that opportunity. It's something where people are just waiting to get out. We certainly know that things like, drugs are available if you want them, often in the prisons. So this is not an environment that's really conducive to making people better individuals and ones that are ready to get a job and really support their families when they get out. So I don't think we're doing a good job in the prisons, and it's important to go and see what's actually there, ask questions. It really is it's a great learning experience.
Well, I'll just say, before this pandemic hit, we were about to relaunch the campaign. In my view, if somebody won't visit a prison, that tells you something. I mean, if your lawmaker won't make the time or effort to spend one day learning these issues, I think you're going to have, it's a good bellwether as to how they're going to vote and respond on these issues. So, we'll start this back up again if, God willing, the prison's open. I want to ask you both, I guess.
I also think, just to add one thing, that really we've had difficulty getting members of the media into the prisons.
Yeah.
And what are they afraid of?
100%.
The prisons should be open to the media to report what's there. If they have a good story to tell, a good story will come out. So
well, not only that,
that is a concern.
Yeah, and they're going to get the dog and pony show likely anyway. I mean, the idea that they can't even accommodate that request, and again, and it's so blasé about it, as if that's not even something they need to consider. It's galling, frankly. I want to ask you both, because we get a question from Dawn Pullman Randalls, which is about the earned time credit bill, and I know we mentioned this. If it doesn't pass, it rolls over to next session? Is that how that works?
It will not automatically roll over. It would have to be reintroduced.
Okay.
I don't see that as a problem. As Molly mentioned, it passed out of the House unanimously, so it will definitely be reintroduced. The problem is that it won't be effective then until really for another year. So those families, those whose loved ones in prison might benefit from that, they're going to have to wait even longer.
All right. Well, we're just about out of time. So what I thought I would do is ask if each of you just want to make some closing remarks. And again, Representative Rangel, I know this is a busy time. I mean, we're focused 24/7 on prison issues, but I'm sure that your constituents have a lot of concerns because of the economy and the shutdown. And so we're very grateful for you for taking this amount of time to talk to families. And I know they'll be in touch with you. Very brave of you to give out your email address. But I just wanted to open up to you and share anything that you can with families and what you plan to do as this crisis continues to unfold.
Well, thank you. And thank you for having me today. And to those of you out there who have a family member in the prisons, I just want to say there's a lot of people who really understand where you are and are really trying to make things better. So you're not alone. And I know that many of you are working together. And I'd like to say, continue your efforts. I think the very best thing to do right now is to, as Molly says, take care of yourself, but also make sure that you are, looking, keeping track of what you're hearing. You're communicating that to lawmakers or to advocacy groups or to the media. And I think that, you can be watchdogs for us, and that is incredibly important. The other thing is to say, to know that there's many of us that are working on these issues. And although you may have heard a pretty discouraging report here about things in Arizona, in my short time in the legislature since 2016, things have actually gotten a lot better. We are having conversations across the aisle. We do have members who are going up against many of those in their party, like Representative Blackman, and introducing legislation that increases things like earned release credits. We are getting some hearings on some of these criminal justice reform ideas. And I think that things may be different after the next election cycle. I hope so. I hope we elect more people that take these issues seriously. We really need to have a really top to bottom reform here in Arizona, starting with some of our sentencing practices, but going all the way through to issues like what we're looking at now, having some kind of authority for reviewing and coming up with home release or other options for looking at people who maybe it's dangerous for health reasons for them to continue to be incarcerated. So there's a lot to be done. There's people who are willing to do it, and you can help us through the process, and certainly you can help us by voting for people who care about these issues.
Well, thanks. Thank you again, Molly.
Well, she said a lot of it. I guess the only other thing that I would add is, as Representative Engel said, there are people in the legislature who want to work on this and are doing good things and introducing good bills and bringing good ideas to the table. And, in Arizona, there's so much to be discouraged and frustrated about, and rightly so. And I never want to blunt anyone's anger, but I think it's also important for us to show some gratitude and say thank you to the lawmakers who are doing good things. I always say, being a lawmaker is a pretty thankless job. Usually you get criticized, but you don't really get any thanks when you do something right. So, as long as when you're writing these letters to your lawmakers and communicating with them, don't forget to say thank you for the good things that they've done and are trying to do. That means a lot to them. I'm sure Representative Engel would agree with me there, and I'm sure Representative Blackman would as well. So, we have a lot left to do, and I know this is a really frustrating and scary and discouraging time, but I think maybe the silver lining is that this crisis throws into such relief all the various ways that we need to be improving the Arizona prison system, starting with transparency and accountability, but also moving to these bigger issues of why are so many old sick people in prison? Why are there so many people in prison? And can we get some of these people out? And why do our prisons cost so much? Let's save some of that money and just be smarter about who we're even putting in prison in the first place. And that's certainly my hope at the end of all of this, is that when this crisis is over, it becomes the launching pad for all these reforms that we've been working on. So I'm really grateful for everyone who tuned in today, and really grateful for Representative Blackman and Representative Engel for taking their time. And you can always, of course, reach out to FAM with any questions about what's going on in Arizona.
Yeah, I was going to say, if you had questions that we didn't get to and they're posted on our page under this video, our staff will get to those and answer those. And otherwise, I think they said everything. I just, the only way not to win this fight is to not fight. And so it is very discouraging at times. And I cannot promise that if you engage, we will win, but I know if you don't, we won't. And so, and as Molly said about thanking people, at FAM, we're nonpartisan, and it doesn't matter if you're a Democrat or Republican, Libertarian or Vegetarian, as they say. If you're for us, we're for you. And I think that that is a good way to approach lawmakers, is to have an open mind and heart to everybody and see them as a potential ally. And if they're not, use your voting power. So with that, I don't want to belabor this. I want to thank everybody who did watch for your questions and for your advocacy. And we'll see you soon. So thanks very much.